Hello, everyone. Welcome. We'll get started in a few minutes because we see that people are still gathering. In the meantime, we have a video for your waiting enjoyment. Thank you. Terrific. So thank you everyone for joining. I'm Kathleen Elmore. I'm Managing Director of Engagys, and I'm thrilled to be here today to talk about increasing patient volumes and patient experience. I'm thrilled to be joined by two esteemed panelists. So first, I'd like to introduce our panelists. First up is Manish Goomar. Manish is Director of Systems Solutions. He's also a healthcare industry veteran. He's currently Director of Digital Systems and Solutions at MIMIT Health, one of the fastest growing independent multi-specialty physician groups in the US. Manish has an impressive history of work in both the hospital and healthcare industry. Also joining us is Evan Crawford. Evan leads the clinical informatics and optimization team within Fusion. Evan has over 12 years experience in healthcare in various roles. He is one of the proven leaders in clinical informatics space driving data solutions. He started his journey as a critical care nurse involved with healthcare EMR applications design and clinical informatics teams at hospitals to help optimize workflows for providers and nursing staff. Over the last 7 years, Evan has helped various health systems realize various health outcomes working in conjunction with patient safety and clinical quality teams. And just a fun fact about Evan, during this COVID pandemic, he's had a baby. So welcome Manish and Evan.
Thank you for having us. Thank you.
Of course. So today we're going to talk about kind of the current market situation, and we're going to hear from Manish of kind of what is happening out there around patient volumes, patient experience, what they're seeing on the front lines, and who better to kind of explain that and highlight some of the challenges and how they're overcoming those challenges than someone who's living it day to day. We'll talk about what those key solution elements are to address those market challenges and address the needs. And then Evan will take us actually through a solution demonstration. And then finally, we'll open it up to Q&A at the end. If all of you look to the right on your GoToWebinar dashboard, you'll see a little area called chat. If you just put your questions into the chat column there, we will answer them in the order that they come at the end. And if for some reason we have too many questions to get to all of them, we will definitely follow up post with the answers to your questions. And so without further ado, I want to turn it over to Manish. Manish, tell us about your point of view of the healthcare industry and MIMIT's position today in this current market.
Sure, absolutely. Thank you first and foremost on having me on this webinar. And just to give you a little bit background about MIMIT Health and what we do. So MIMIT Health is a multi-specialty group, and our mission is to deliver high quality, cost-effective healthcare through a comprehensive, integrated, multi-specialty group of healthcare providers. And our vision is to use our skills and resources to help people in the communities we serve to live a happy and healthy life. With that being said, the current market right now in the healthcare industry is very interesting, just because of everything that's been going on with with COVID and the pandemic. And the healthcare industry is going through a digital transformation, and the pandemic actually helped accelerate that digital transformation as well. And right now, one of the challenges that we see is a lot of big health systems have many different systems and silos, and it's really lacking interoperability in that data to be visible to patients, patient engagement team members, revenue cycle management, and the physicians. So one of the ways that we look at data is, we have 4 levels of data. We look at data, and that data turns into information, which then turns into knowledge. Once you obtain that knowledge, it actually turns into wisdom, which is actual insights. So right now, the challenge is, how do we get this data across multiple different platforms and being able to leverage this data to make actual insights and being able to serve patients more frequently and effectively? So that's where, digital solutions and platforms come into place, such as Salesforce.
That's terrific. Now tell me, how are you all using your Salesforce stack for your business?
So we have many different Salesforce products within our business. We have, Einstein Analytics. So we always start with asking the question why and starting reversing engineering the process, right? So we look at the analytics first and try to answer the main questions that really impact our business. And we found that Einstein Analytics, which is now Tableau CRM, has been very helpful in our practice to be able to make an impact in the business and recover the revenue. Now, when we look at different products as well as Service Cloud and Health Cloud, which is, Health Cloud is built actually on top of Service Cloud. Health Cloud has been a tremendous investment and given us a lot of ROI because of the fact that we're able to integrate many different systems within this platform. And Health Cloud gives you the ability to leverage their data models to be able to have the single source of truth all in one system and really make it visible to different departments within the organization, such as patient engagement, the physician, the care coordinators, and the revenue cycle management team. The next product that we have on our stack is Pardot and Marketing Cloud, which is really having that B2B, which is the business to business, and the business to customer, which is, having the B2C model, which is Marketing Cloud. And that has been very helpful for us to engage and interact with our patients and the businesses that we deal with, whether it's hospitals, different private practices, and really to adapt and be agile.
No, that's great. A couple of things you mentioned in trends, just because we're on the consumer side of things, that I just wanted to point out. You talked about kind of the wind at our back in terms of getting more patients, to digitally engage, which is fantastic. We even heard some studies that showed that consumers are actually afraid of their printed mail. So there's never been a better time to engage them digitally, through the practice. And so you're really finding that consumers are much more likely to want to interact with you through digital, correct?
Yes, definitely digital. And, healthcare is catching up to this digital transformation. And with the pandemic, you do have to be contactless as well. So it's very important to engage with your patients and making sure that their problems are being treated. And, everyone has a cell phone nowadays and an email. So it's really coming to that point where everyone wants to become paperless and really having that digital engagement with one another.
It's terrific. And really, Salesforce enables that so beautifully. What is your roadmap? Like, where are you headed?
So our roadmap is, honestly, is we want to be able to hyperscale. When we look at Salesforce, Amazon, and Costco, these big companies are hyperscalable and they all have a system and platform to do so. For us, it's really taking care of more patients and making and adding value to the patients. And we want to do that at a very high scale level. Right now, we're in the Chicagoland area, but we want to be able to scale up and go into different regions around the country as well and serve the patients and be able to treat their problems.
That's terrific. You touched on analytics, but I think there's more to be said. I think you guys are using it really well. Do you want to just talk a little bit more about how you're leveraging analytics?
Absolutely. So, we leverage analytics in every department, and, with Einstein, Tableau CRM now, it's been tremendous in terms of the impact that it had on our business. We really look at the patient analytics, the care coordination side, revenue cycle management, and the patient engagement side. So when we look at these different channels of analytics and really getting that descriptive view of what needs to be done next, it's been very helpful for the team members to say what can happen next. And with Tableau CRM, they do have different features within the products where it gives you next best action and how to really automate the next decision that is being made by the team member to provide excellent care for the patient.
That's terrific. And you hit on what I hear is and with our clients too, the hot topic across the industry is how you facilitate this next best action, to what's most important to the consumer. So Manish, you really outlined not only what the market needs are, but the critical elements needed to address those market needs. Things like complex, patient analytics and prioritization, customized patient engagement plans, automating this patient care journey, as well as the multiple, multi-channel follow-up reminders and outcomes analytics. And so part of the role that Engagys plays is really around these kind of automated patient care journeys, as well as the multi-channel follow-up and reminders. Engagys got together and basically worked on a solution that really outlines this customer journey. And Fusion and Engagys together built out this comprehensive engagement model, leveraging Tableau, Health Cloud, Marketing Cloud, and Community Cloud. One of the things that we found through our research was that when the world first closed, consumers really thought it was closed because it was not safe to go back into care systems, when in reality it closed just to conserve PPE. And so really having these patient journeys both on a personalized but also interactive, being able to overcome barriers, things like that, go a long way to overcoming their issues and making sure they get the care they need. So the solution we put together ties all of these assets together, the Tableau Health Cloud, Marketing Cloud, Community Cloud, leveraging software integration, patient data, the patient data used consistently across these products, and the content all the way down to the detailed email and call script copy. Again, really critical to, again, drive that personalization, next best action. And the engagement works in part because we've included best practices, things like behavioral economics. A great example of behavioral economic is scarcity. If I call you, Evan, and say, hey, do you want to go, schedule that knee specialist? Your first reaction is, let me check my calendar, I'll call you back. Evan, whether Evan calls back or not, is probably in question. But if the caller said, hey, Evan, I've got one terrific specialist open and he's got one spot left next week, can I put you in? It just completely changes your mentality around taking that appointment. That behavioral economics is called scarcity, but we've baked these behavioral economics in to get you the most effective response and results as possible. We have a proven approach to orchestrating outreach across multiple communication channels that include live agents, emails, and even outbound IVR. And just one example, is that this idea of FOMO, fear of missing out, is another great example of using behavioral economics. If a consumer says, no, I don't want to schedule that, and you say, are you sure? There's just this little bit of that consumers go, wait a minute. And if you deliver a barrier breaking message on top of that, you can usually turn 30% of no's into yeses, whether it's, scheduling for knee surgery or a well visit or immunizations, you name it. So really, the impact of automation and technology on a patient appointment scheduling has real ROI. There's real money behind doing this. We've run some numbers based on conservative assumptions about average revenue per appointment, average appointment setting rates, engagement rates, return phone call rates, and more. And by putting about 10 agents to work, complemented by smart targeting and prioritization and integrated and automated email and IVR outreach, you can drive anywhere from 50K, 100K, 150K per day or more in appointments scheduled. So real ROI there. I want to pause for a minute and turn it over to Manish. Manish, you're kind of at that front lines. Tell me about the value you're seeing by a coordinated approach around this.
Absolutely. So when we look at the technology and specifically at Salesforce and the different products it offers, it definitely has a big impact on the business and how much revenue you can recover in terms of patient scheduling. And even if you look at the pandemic, most practices took a 60 to 70% hit across the country. People didn't know what to do because they didn't have the technology or the system to sustain and to be able to adapt to the new paradigm. Now, with the technology that we had, we were able to recover the revenue and be able to schedule patients using a telehealth solution integrated with Salesforce, and that's the beauty behind it. So with that being said, by having the technology behind you and being able to formalize that in such a way, it becomes an automation where you actually start recovering more revenue and generating more revenue based on the processes, and that leads to operational excellence and utilization management.
Absolutely. Thank you. No, that's terrific to hear. With that, I'm going to turn it over to Evan. Evan, I'm going to make you presenter here while you get queued up.
Okay, sure. Let me talk about this slide real quick. And thanks, Manish. Thanks, Kathleen, for that introduction and everything you said at this point. My name is Evan Crawford. Like Kathleen said, I'm the Director of Clinical Informatics at Fusion. I spent my early years in healthcare as an ICU nurse. So a lot of what I'll tell you is based on experience as well as the solution that we've designed with Engagys, and really an end-to-end solution starting with Tableau and analytics, which is what our company focuses on a great degree on in healthcare, as well as integrating that information with Marketing Cloud, Community Cloud, and Health Cloud as well, so that we can have an end-to-end solution and ultimately at the end of it also provide Tableau analytics to see how well we did in revenue recovery, as well as what did we do the right things for the patient. Again. Okay, so this demo will be pretty brief, and what I'll do is when I'm done is I can contact you afterwards, or we can contact and have communication to have a deeper dive in this particular demonstration. But what I'm going to show you, and I want you to think about a few things. Typically, we meet with practice administrators, practice managers, physician leadership, nurses, nurse practitioners, and schedulers that will utilize these particular tool set. So what you're seeing here is actually our Health Cloud instance where we have Tableau dashboards that are embedded within the Health Cloud instance. So for this particular demonstration, we're going to be talking to a pediatric cardiology group where their particular need is to look at congenital heart disease patients and to help understand where they can attack this population, outreach this population, engage this population through different modalities such as Marketing Cloud, Community Cloud, and utilizing Health Cloud as really the vessel to move the analytics through the process and engage with that patient and be the track record, so to speak, of all the engagement that we have with that particular patient. So what you'll see here is a program overview, and we like to always start with the initial population. So in this case, it's congenital heart disease patients by a particular cardiologist, as well as by fundamental diagnosis groups such as ventricular septal defect. And what you'll see here is that it'll aggregate those patients by whether they're alive or deceased and the total population overall. But in general, we'll also segment these patients into sub-diagnosis groups, as well as the repair status, which can indicate greater opportunity to occur or get revenue inside of our doors as a practice. But really, where the nurse or scheduler, but mainly the nurse who's engaging with this patient needs to understand the clinical outlook for this particular population. They're going to want to know, who do we prioritize? What is the acuity of these patients? And how ultimately we can, sorry, I lost my screen here. How ultimately we can understand this patient population better, how we can see the rescheduling weight, how we can understand their acuity level, when's the last time they've been seen by a particular cardiologist. And then ultimately, when we have that prioritized list, which I'll show you in just a second, we can then outreach directly into Health Cloud and do a lot of automated marketing journey kickoffs for this particular patient. Okay. So what I want to show you is on this slide, there's a help button over here, and then when you click this, I'm sorry, it keeps Okay, there we go. There's a help button on the slide, and it helps us to understand, to provide to our providers an explanation of how these things are actually, the algorithms behind it, and the necessary data and information that describes to me what this dashboard represents, so that I know what the diagnosis repair weight looks like. I know what the scheduling categorization is, so whether they need a follow-up or whether or not they don't need a follow-up. I'll also know the scheduling weight score, so their appointment weight, their follow-up weight, their scheduling score overall, and how that is determined, is by when they've last seen the provider, what their diagnosis is, what the repair status is, so that I can appropriately create an algorithm that prioritizes these patients based on acuity, but also need to get in my doors. And once this list is accrued, this will automatically get fed to Salesforce within Health Cloud. We'll also kick off subsequent marketing journeys for practice updates due to COVID-19, or general information about the practice and what's going on in the future, so they can stay in constant communication with these particular patients. So in this particular case, we're going to look at a patient, Mary Bennett, who's our highest priority ranked patient for this pediatric cardiology group. And I can see Mary Bennett has the highest priority rank, and I can actually click her name as a nurse, go out to her patient record within Health Cloud, and I can look at different sort of things like the patient card to understand, what is their fundamental diagnosis, what medications are they on, when is the last time they've seen a provider, all the particular accounts that have occurred during this time frame. We can also look at different clinical data, in particular service appointments. So if I call Mary Bennett right now, I can go ahead and schedule a service appointment. But there's a litany of information regarding clinical status on this particular page, but it also allows me to understand what I need to know as a nurse so that I can communicate to the patient effectively. And then if I wanted to set up an appointment, it's very easy, and you can integrate this information with your scheduling software for your EHR and in your practice to set up a follow-up visit for Mary Bennett. So we're going to go ahead and do that, set up a follow-up visit. We'll make it in person with Dr. Meyer at FHG South, and we'll go ahead and save that. And so it's really easy to schedule while you're on a call with Mary Bennett. As you know, the patient engagement, you can also see past engagement levels. So all the emails that I sent automated. In particular, what are the automations that come from Engagys, the product that Engagys has made, to understand and outreach to this patient. So when they get brought into our Salesforce instance, they will have a practice update that gets automatically sent to them. And this is evidence-based templated information that can come right out of the box. And really, to look at these emails to see what kind of communication has been sent to this patient in the past, for the practice updates, to give you an idea of what that looks like, that email would go out to the patient. They'd be able to see certain things. So what are the resources they need to know? What are the telehealth hours for our practice? And then ultimately, how Community Cloud comes into this is they can go directly to our website or the Community Cloud instance, understand more about their health, understand more about different COVID-19 resources, COVID-19 general information, but they could also go to things like preparing for an office appointment. What types of things should I do? So if I click on this, it'll actually tell me, these are the types of things you need to be prepared for when you come in for an office visit. And then ultimately, if they do miss their appointment, and that's a cause, and it's a great higher occurrence during this particular time, just because patients are somewhat afraid to come into a physician's office. But if they did miss their appointment, it also generates an automatic email that will tell them to, hey, call our facility. These are what you should do to prepare for your next in-person appointment. If you don't feel comfortable, what are the things that we can do as an organization to make you feel comfortable? And this gives you an idea of a marketing journey or marketing cloud specifically. There's events that are triggered. So like I said, once that patient population is made and created through an algorithm based on our analytics practice, we can understand and kick off a decision tree to give that patient a practice update email. As well as if they do miss an appointment, if that data slipped, or if we do an automatic trigger within Health Cloud, we can go ahead and kick off that journey to make sure they get their information on missed appointments in a three-phased approach, so that it'll be brought back in. The other thing we offer is patient sentiment. We want to know, what do patients feel like? Where can we get this kind of qualitative information from the patient to make them feel more comfortable when they come into our doors? So really, when you're on the call as a nurse, I would ask the patient, how comfortable do you feel for the next visit? If they don't feel comfortable, we want to know why. How can we help? And let's say they say, I want a telehealth visit, and maybe the last reason that I canceled my appointment in the first place was because of a transportation issue. If it's because of things like that, this elevates the patient in prioritization scheduling so that we can outreach to this patient pretty quickly and do it effectively for our practice. You can also create new tasks for engagement, so calls, send letters. If you want the scheduler to make sure that they call the patient on a particular time, or you want someone, the practice, to send out a letter to this particular patient because they need a prescription update, or they need to get their appointment rescheduled or a procedure rescheduled, we want to go ahead and do that. It's very easy to do. We can create a call. We can save that particular information, so it'll be there, and it'll also be over in our activities, but it'll also be driven to our scheduler so that the scheduler knows to call Mary Bennett, and it'll be on his or her task list. Timeline is a great way to see the engagement process overall. So for this particular patient, we can see when they were discharged from the hospital. We can see when they had a last consultation. We can see when they had multiple calls of engagement, letters sent to them, and we can understand, how many touches are we given to this particular patient to actually bring them back in and to do the right thing for the patient, not only for our business, but also for them and their care. And you can also place them on different care plans. For our cardiology practice, we have a cardiology rescheduling pathway that we've set up that really we want to understand, and we want to try to get all those patients that maybe had canceled or postponed appointments. Because this particular population, particularly in the pediatric space, is very vulnerable to adverse outcomes. So we want to make sure that we do not lose touch with them and that we ultimately get them back into our doors and get them seen. And that will be a follow-up for reschedule. So taking my nurse hat off, I'm now transitioning to kind of a scheduling view. So when the scheduler logs in, he or she will see a prioritized patient list based on some of the actions that I take as a nurse, so that I can drive those kind of conversations and make sure that the scheduler, when they come in, they have certain tasks that they have to do during the day, and that'll be over here so they can call the patient, they can update the patient's record within Health Cloud, make sure that they got certain emails, make sure they got certain communication. But they can also understand at a clinical level some of the, the mix of their patients that they have to outreach to. So what are the allergy intolerances they have? What are the EHR conditions or diagnoses that they have? What are the medical prescriptions that they need to have? And then that's pretty short and sweet, but a lot of the same initiatives like calling a patient, updating patient sentiment, that can also be recorded by a scheduler as well. And then if I'm the practice administrator or a physician leader, I want to know kind of how well we're doing. And this dashboard ties everything up to say, of the appointments that we have, so 2,833, only 1,300 or so have arrived to our facility. It shows our canceled, our no-shows, our bumped appointments, those patients that need follow-up require still, those patients who don't need follow-up. Really trending over time, our arrivals versus appointments, our 12-month trend, and ultimately our money. So where are we recovering and how much money does that represent? So that patients, our activities, our marketing activities, our clinical activities, how are they driving better outcomes, and ultimately how are they getting patients back into our care? So for instance, University Clinic got $177,000 back in what we consider recurred revenue, or patients that otherwise would have been lost, or appointments that otherwise would have been lost. And then also you'll see arrivals by location, whether or not those patients actually arrive versus not arrive, and then trending over time. So we can look at our, our high contact providers, those patients that that provider represents, how many are actually coming in, and you can interact with that. So that is the end of the demonstration. I appreciate you guys' time, and I really appreciate Manish's insights into the business that he's working for at MIMIT Health. And Kathleen, thank you for driving. And I'm going to pass it back over to you, Kathleen. And if you have any questions about this demo, or if you want to go in a deeper dive or have a personal demonstration, feel free to contact me after this webinar.
Terrific. Thanks, Evan. That was a terrific demonstration. And as Evan mentioned, if you want some questions answered immediately, feel free to put them in the chat bar. Manish, I know you're living this every day. Do you want to add any thoughts to Evan's demo in terms of some of the kind of the highlights that you love about the solution?
Yes, absolutely. He hit it on the spot with the technology of Health Cloud and the analytics behind it. You always want to look at the data, and based off the data, if you have the right information, you'll make the right decision to get the right rewards, right? Just as a prime example, the Golden State Warriors, if there's any fans in the webinar, they've been a big championship team for the past couple of years, and they really use analytics to do that as well. And we want to be able to do the same in healthcare and provide excellent patient quality, as well as being able to schedule more patients in and treat more patients on that front. So once again, the demo and solution behind it is very impactful, and I definitely recommend to look more into it.
Terrific. Thanks, Manish. So why the Fusion and Engagys partnership? You're all asking yourselves, I know. It is a great way to simplify the sales support and the contracting by working together through a single agreement. Fusion brings the Tableau, Engagys brings the Salesforce Marketing Cloud expertise. Together, we have the Salesforce Health Cloud and Salesforce Community Cloud expertise. But it really allows you a differentiation point over alternatives. Gives you quicker time to value by having kind of a pre-configured software solution. Your content's right out of the box and optimized on these barriers, the behavioral economics, all the things that are getting in your way of getting folks back in. And both teams have proven deployment experience. The next piece is optimized design. One of the things I didn't mention early on is my background before coming to healthcare in 2005 was working for the large consumer products company giants. I like to say getting you to eat when you weren't hungry and buy things you didn't need. And so taking those same methodologies, A/B testing, targeting, segmentation, and baking them into your solutions in an easy to deploy way is going to help you get up that results curve faster. And then additionally, we take the insights that we've learned from over 1 million interactions with healthcare consumers, really peeling back that onion on what works to drive what specific behaviors to what populations. And again, bake that in to start you at a much more successful starting point. Again, reflects the latest of federal guidance. And then there's a completeness of solution. Really, this is the way to move consumer behavior, is to start with that targeting, to drive personalization, to manage these consumer interactions, to ultimately end with appointments kept. So overall, a really easy and effective way to solve this challenge that this entire industry is facing right now of getting consumers back into care. So with that, I want to say a huge thank you to both our panelists, but also the audience for taking out time on your lunch hour or post-lunch hour. I've got a few questions that I'm going to throw over to Manish, but please do throw in some questions into the chat bar. Okay. Manish, based on your experience with Salesforce, what is the #1 lesson you have learned for someone that is embarking on this journey now? I think that's a great question.
Yeah, so when we look at the Salesforce journey in the healthcare industry, one of the biggest things is understanding the technology and the functionality behind it. So you can have any tool, but what matters is how you use the tool, right? And making sure that you have a good plan around it, making sure you follow methodologies such as SDLC, which is software development lifecycle, and making sure that you really manage the project so you fit in with the budget. What typically happens is most of the challenges with organizations is that they will go over budget or they don't plan properly, but it has to go both ways to ensure that you get the right outcomes when you're doing the implementation of the technology itself.
No, that's great. So it really speaks to the fact that these out-of-the-box solutions make it easier to realize the value of the tools.
Yep, exactly.
And what are the challenges that you faced during implementation with these products?
Some of the challenges I have faced is really looking at, number one is looking at the functionality and understanding the product. When we look at Salesforce, it's a big technology company with many different solutions and products, and you're always learning new things every day. They always have updates coming along. So it's just being mindful of all the updates and really taking the time to learn it, number one. And number two is you really have to be agile, dynamic, and reactive. And at the same time, have a very good change management solution where you can sustain being so agile within the company.
No, that's great. That's great. My next question, Evan, is for you. What kind of algorithms are you using to score patients, and how are those developed?
Sure. So we do use some, some national standards like MIMIT scoring for surgical elective surgery, and in particular around COVID restart. There's about 21 data points that you utilize to prioritize those patients, not only from the risk perspective, but also from a revenue standpoint, what they represent during that particular algorithm. Now, we don't always use that. So the information I just showed you, we worked with a cardiothoracic surgeon to help develop that particular algorithm based on their surgical representation. So basically, what is the level of risk with their particular disease? What is the process it usually takes from a clinical standpoint? And how can we ultimately understand what it means to not contact this patient? How long can they go without this being repaired? So we want to make sure that we understand the risk for both the patient and ultimately, the practice itself, because it does represent quite a bit of revenue, but it's what's best for the patient to get them in contact, because a lot of times when a child is born with a congenital heart disease, they fall through the cracks after they leave the facility, and ultimately. So we want to make sure that cardiologists at least get a chance to see these patients, but it also helps drive revenue, it helps drive engagement, and it's what's best for the patient overall. But to make a long story short, we work with any individual practice, hospital system to help develop that algorithm to make sure we're prioritizing patients based on your definition for your organization and how you see it fit, particularly with physicians, because I personally work a lot with physicians, so I like to definitely get their input for this prioritization.
That's great. It sounds like you guys have thought of everything and you're really getting the high prioritization, important patients in earlier. So terrific. Next question is actually for me. Is content already available on the platform with Salesforce for clients to use, and how does that work? Yes, it's already baked in. It's evidence-based, and there's templated libraries available right out of the box, so that you don't have to worry about generating the content yourself. And as I mentioned, we use best practices. We tailor it by population, seniors versus millennials. One of the things I love to say is that, seniors, when you talk about behavioral economics, authority works great, which is having something, someone from a credible source tell them what to do, like a doctor. But for social proof, which is like peer pressure, it stops working, which is, kind of good news if you're still feeling the peer pressure from high school. So, tailoring it to the populations and to the specific actions is critically important to make it successful. Evan, how does this interact with an EHR system?
So Salesforce, Health Cloud's awesome for integration with practically any EHR. We get a lot of data from the EHR, but we also get that information from directly through Tableau. But we can feed Salesforce information back into Tableau and vice versa. So really, there's multiple points of integration. So it really doesn't matter what EHR practice has or a hospital system has. we're able to integrate with that pretty seamlessly. And we have, years of experience with integration with DHRs. In particular, I've worked a lot with Epic, and just because of the footprint and the nature of the business, but we've done numerous different EHRs, particularly in the provider space, as well as hospital space.
That's great. And last question from the audience, unless someone wants to throw another one on now, is Manish and Evan. Sounds great, but how long does the implementation take?
Sure, absolutely. So that all depends on you. It's all specific to how you manage the project and how you want to engage with different stages of the project. And it's not a sprint, it's a marathon. So it's always about being slow and steady and making sure it's a win-win situation for your business and how you're going to impact your business by phases. And it's ultimately up to you and how you want to decide of how urgent it is versus, you look at mission critical, is it nice to have, is it important, and then you make it based off those decisions.
Yeah, completely. I think things are best done in phases so that you can see what impact even small steps can make. So, is it implementing to Health Cloud? Is it starting an analytic program? Those kind of things can tell you right away what kind of value or ROI you're going to receive from it. It's a good indication of the project overall. So you can have all these different products that work together. And it's a big solution. It's an awesome solution. But it's best to take those things in chunks to help understand not only how well this can be implemented, how to work with a different partner that might implement the solution, how your physicians are going to react to it, because that is the main thing. You can have a Lamborghini of solutions, but if no one uses it, it's worthless. So
that is great advice to end on. So we have no further questions from the audience. I want to say a giant thank you to both Manish and Evan. Honored to have you on the panel. I thought it was a terrific, overview and understanding of the tools and the value out there. So, any follow-up questions, just reach out to our contact info. And we thank you all for taking the time to join us.
Yes, thank you, Kathleen. Appreciate it. Thank you, guys. Have a great day.
Take care.
Thanks,
Bye-bye.
guys.